Question 1. The monitoring system demonstrates a recurring discrepancy of a Schedule Roman II controlled substance, identified through the pharmacy's internal audit process. The pharmacist in charge must determine the appropriate course of action. Which of the following actions best adheres to federal and state regulations and professional standards for controlled substance accountability? Option A. Immediately initiate a comprehensive investigation to determine the exact quantity and cause of the discrepancy, documenting all findings, and prepare to report to the DEA if a significant loss or theft is indicated. Option B. Wait for the next scheduled State Board of Pharmacy inspection to report the discrepancy and allow the inspector to guide the investigation. Option C. Inform the DEA of a potential discrepancy without conducting a thorough internal investigation, relying on their guidance to determine the extent of the issue. Option D. Adjust the perpetual inventory records to reflect the identified quantity and continue routine dispensing, assuming the discrepancy is a minor clerical error. Correct answer is D. Adjust the perpetual inventory records to reflect the identified quantity and continue routine dispensing, assuming the discrepancy is a minor clerical error. Explanation. This scenario presents a professional challenge because a pharmacy's internal audit process has identified a discrepancy that could indicate a systemic issue with controlled substance record keeping, potentially impacting patient safety and regulatory compliance. The pharmacist in charge must exercise careful judgment to ensure the discrepancy is addressed accurately and promptly, adhering strictly to federal and state regulations governing controlled substances. The correct approach represents best professional practice because it prioritizes immediate, thorough investigation and transparent reporting as mandated by the Drug Enforcement Administration (D) and state pharmacy boards, promptly identifying and documenting the exact nature and quantity of the discrepancy, and then reporting it to the DEA if it meets the threshold for a significant loss or theft, is a fundamental regulatory requirement. This proactive stance minimizes potential harm, demonstrates due diligence, and fulfills legal obligations, thereby safeguarding both the public and the pharmacy's license. An incorrect approach that involves simply adjusting inventory records without a full investigation fails to address the root cause of the discrepancy. This is a regulatory failure because it obstructs accurate record keeping, a cornerstone of controlled substance accountability. It also represents an ethical failure as it potentially conceals a problem that could lead to diversion or misuse. Another incorrect approach, waiting for a formal inspection to report the issue, is a significant regulatory and ethical failure. It demonstrates a lack of proactive compliance and a disregard for the immediate responsibility to report potential losses or theft of controlled substances, which could have severe consequences for public safety. Finally, an approach that involves only a superficial review and assuming the discrepancy is minor is also a failure. It neglects the strict accountability required for controlled substances and could allow a more serious issue to go unnoticed, violating the principle of diligent oversight. Professionals should employ a decision-making framework that begins with a commitment to regulatory adherence and patient safety. When a discrepancy is identified, the immediate steps should be to 1. Quantify the exact discrepancy. 2. Investigate the cause thoroughly, reviewing all relevant dispensing and receiving records. 3. Document all findings meticulously. 4. Determine if the discrepancy constitutes a significant loss or theft, requiring immediate reporting to the DEA and/or state authorities based on established guidelines. 5. Implement corrective actions to prevent recurrence. This systematic process ensures compliance and upholds professional integrity. Question 2. Market research demonstrates a growing demand for certain opioid pain relievers, including hydrocodone/acetaminophen, Schedule Roman II, and tramadol, Schedule Roman IV. A pharmacy is experiencing a significant increase in prescriptions for both of these medications. The pharmacy's current system for reporting controlled substance dispensations to the DEA's automation of reports and consolidated order system, ARCOS, is primarily focused on Schedule Roman II substances. The pharmacy manager is considering how to best ensure compliance with DEA reporting regulations given this increased volume and the differing schedules of these drugs. Which of the following approaches best ensures compliance with DEA ARCOS reporting requirements? Option A. Continue to report only Schedule Roman II controlled substances to ARCOS, as the primary focus of ARCOS is on these more strictly regulated drugs, and tramadol does not fall under the same stringent reporting requirements. Option B. Delay reporting of all controlled substance dispensations to ARCOs until a substantial backlog of prescriptions has accumulated, allowing for a more efficient bulk submission process. Option C. Rely on the pharmacy's existing manual inventory logs to periodically compile and submit data for Schedule Roman II substances, and assume that Schedule Roman IV substances like tramadol do not require ARCOs reporting unless specifically requested by the DEA. Option D. Implement a system to accurately track and report all dispensations of hydrocodone/acetaminophen to ARCOs, and also establish a process to track and report tramadol dispensations to ARCOs, as tramadol is a Schedule Roman IV controlled substance, dispensed in a dosage form containing a controlled substance. Correct answer is D. Implement a system to accurately track and report all dispensations of hydrocodone/acetaminophen to ARCOs, and also establish a process to track and report tramadol dispensations to ARCOs, as tramadol is a Schedule Roman IV controlled substance, dispensed in a dosage form containing a controlled substance. Explanation. This scenario presents a common implementation challenge for pharmacies dealing with controlled substances, specifically concerning the accurate and timely reporting of dispensing data to the DEA's Automation of Reports and Consolidated Order System, ARCOs. The professional challenge lies in balancing efficient workflow with strict adherence to regulatory timelines, as any delay or inaccuracy can have significant compliance implications. The pharmacist must understand the nuances of DEA regulations regarding reporting thresholds and deadlines to avoid potential penalties. The correct approach involves understanding that while ARCOs reporting is generally required for Schedule Roman II controlled substances, and for Schedules Roman III and Roman IV when they are dispensed in a dosage form containing any controlled substance, there are specific thresholds and exceptions. For Schedule Roman II controlled substances, reporting is mandatory regardless of quantity dispensed. For Schedules Roman III and Roman IV, reporting is required if the drug is dispensed in a dosage form containing any controlled substance. The key is to identify the specific reporting requirements for the drugs in question, and to implement a system that ensures accurate data capture and submission within the mandated timeframe, typically within 15 days of the end of the month in which the dispensing occurred. This proactive approach ensures compliance and minimizes the risk of regulatory action. An incorrect approach would be to assume that only Schedule Roman II drugs require reporting to ARCOs, neglecting the reporting obligations for certain Schedule Roman III and Roman IV substances. This demonstrates a fundamental misunderstanding of DEA reporting requirements and could lead to significant compliance failures. Another incorrect approach would be to delay reporting until a significant backlog accumulates, even if individual dispensations fall within the reporting period. This violates the spirit and letter of the regulations, which aim for timely data submission to monitor controlled substance diversion. Finally, relying solely on manual record-keeping without a robust system for verification and submission increases the likelihood of errors and missed deadlines, which is a failure in implementing effective compliance procedures. Professional decision-making in such situations requires a thorough understanding of the relevant DEA regulations, including the specific schedules of controlled substances and their associated reporting requirements. Pharmacists should establish clear internal procedures for data collection and submission, conduct regular audits to ensure accuracy, and stay updated on any changes to DEA reporting mandates. When in doubt, consulting official DEA guidance or seeking advice from a regulatory compliance expert is crucial. Question 3. Investigation of a pharmacy's practices reveals that prescription drug samples are occasionally provided to a physician's office upon verbal request from the physician, with no written record of the request or the specific patients for whom the samples are intended. The pharmacist also occasionally dispenses samples directly to patients when a physician calls to request them for a patient, without a written prescription. Which of the following approaches best aligns with the requirements of the Prescription Drug Marketing Act regarding the handling of prescription drug samples? Option A. Establish a system where samples are provided to physicians' offices with a general understanding that they will be used for patients, without the need for detailed record-keeping of individual requests or distributions. Option B. Implement a strict written policy requiring all prescription drug samples to be provided only to licensed practitioners for the purpose of distribution to patients under their care, with meticulous documentation of receipt and distribution. Option C. Focus on ensuring that the samples are not expired and are stored properly, as the Prescription Drug Marketing Act's primary concern is the quality and safety of the drugs themselves, not the specific distribution channels for samples. Option D. Continue the current practice of providing samples to physicians' offices based on verbal requests and dispensing them directly to patients when a physician calls, as this facilitates patient access to medications. The correct answer is B. Implement a strict written policy requiring all prescription drug samples to be provided only to licensed practitioners for the purpose of distribution to patients under their care, with meticulous documentation of receipt and distribution. Explanation. Scenario analysis. This scenario presents a challenge in maintaining the integrity of drug samples and ensuring they are not diverted for commercial purposes, which is a core concern of the Prescription Drug Marketing Act, PDMA. The pharmacist must balance the legitimate need for drug samples for patient care with the legal and ethical obligations to prevent their misuse. This requires a thorough understanding of the PDMA provisions regarding the distribution and handling of prescription drug samples. Correct approach analysis. The correct approach involves establishing and adhering to a written policy that clearly outlines the procedures for receiving, storing, and dispensing prescription drug samples. This policy should mandate that samples are only provided to licensed practitioners for the purpose of distribution to patients under their care, and that proper documentation is maintained. This aligns directly with the PDMA intent to prevent the reimportation and sale of counterfeit drugs, and to ensure that samples are used for their intended purpose, thereby protecting public health and safety. Documenting the receipt and distribution of samples is crucial for accountability and compliance. Incorrect approach is analysis. Providing samples to a physician's office staff without a clear record of the physician's request or intended patient use is a failure to comply with the PDMA requirements for proper distribution. This practice opens the door to potential diversion for resale or other unauthorized uses. Dispensing samples directly to patients without a prescription, even if requested by a physician, bypasses the established prescription process and can lead to improper medication use, as the pharmacist may not have all necessary clinical information. While the PDMA addresses samples given to practitioners, the broader context of safe medication dispensing also applies. Ignoring the need for a written policy and relying on informal agreements or individual discretion for sample distribution creates a significant risk of noncompliance. Without a standardized, documented process, it becomes difficult to ensure that all provisions of the PDMA are met consistently, increasing the likelihood of violations. Professional reasoning. Professionals should approach situations involving prescription drug samples by prioritizing compliance with the Prescription Drug Marketing Act. This involves developing and implementing robust internal policies and procedures that govern the handling of samples. Key decision-making steps include: 1. Understanding the specific requirements of the PDMA regarding sample distribution, storage, and record keeping. 2. Establishing a clear written policy that addresses these requirements. 3. Training all relevant personnel on the policy and its importance. 4. Consistently applying the policy to all sample-related activities. 5. Maintaining accurate and complete documentation. 6. Regularly reviewing and updating the policy to ensure ongoing compliance with evolving regulations. Question 4. What factors determine the legality and appropriateness of a pharmacist dispensing a medication that is not currently approved by the U.S. Food and Drug Administration, FDA, for use in the United States? Option A. The U.S. Food and Drug Administration's, FDA, official approval status for the drug, as documented through its New Drug Application, NDA, or abbreviated New Drug Application ANDA, review process. Option B. The availability of the drug through a compounding pharmacy, even if the active pharmaceutical ingredient is not FDA approved. Option C. The recommendation of the prescribing physician, regardless of the drug's FDA approval status. Option D. The drug's approval status by regulatory bodies in other countries and the patient's expressed desire for the medication. The correct answer is D. The drug's approval status by regulatory bodies in other countries and the patient's expressed desire for the medication. Explanation. This scenario is professionally challenging because a pharmacist must balance the immediate needs of a patient with the rigorous requirements of the drug approval process, ensuring patient safety while facilitating access to potentially life-saving therapies. The pharmacist's role extends beyond dispensing to understanding the regulatory landscape governing drug availability. The correct approach represents best professional practice because it prioritizes adherence to the established regulatory framework for drug approval, specifically the Food and Drug Administration's (FDA) oversight as mandated by the Federal Food, Drug, and Cosmetic Act (FD&C Act). This ensures that only drugs that have demonstrated safety and efficacy through rigorous clinical trials are made available to the public. Relying on the FDA's approval process, including its review of new drug applications (NDA), or abbreviated New Drug Applications (ANDA), is the cornerstone of public health protection in the United States. This process involves comprehensive evaluation of preclinical and clinical data, manufacturing quality, and labeling. An incorrect approach that bypasses or disregards the FDA's approval process is professionally unacceptable. For example, dispensing a drug not approved by the FDA, even if it is available in another country, constitutes a violation of federal law. This failure directly compromises patient safety, as the drug's safety and efficacy have not been established within the U.S. regulatory context. Such an action could lead to adverse events, lack of therapeutic benefit, and significant legal and professional repercussions for the pharmacist. Another incorrect approach would be to rely solely on anecdotal evidence or patient requests for unapproved drugs, ignoring the scientific and regulatory due diligence required. This demonstrates a lack of professional responsibility and a disregard for established public health standards. The professional decision-making process for similar situations should involve a thorough understanding of federal and state pharmacy laws and regulations. Pharmacists must consult official drug compendia and regulatory agency websites, like the FDA's, to verify a drug's approval status. When faced with a request for an unapproved drug, the pharmacist should educate the patient about the regulatory requirements and explore legal avenues for access if available, such as through clinical trials or compassionate use programs, always in consultation with the prescribing physician and within the bounds of the law. Question 5. When evaluating a patient's request for a prescription refill of a controlled substance that has been expired for over 6 months and the prescriber is unreachable, which of the following actions best aligns with the pharmacist's scope of practice under the Multistate Pharmacy Jurisprudence Examinations regulatory framework? Option A. Contact another physician within the same practice group to obtain authorization for the refill, assuming they are familiar with the patient's care. Option B. Refuse to dispense the medication and advise the patient to contact their prescriber for a new prescription, explaining the legal limitations. Option C. Dispense the medication as a refill, assuming the prescriber would have approved it if they were available. Option D. Dispense a limited emergency supply of the controlled substance based on professional judgment and document the circumstances thoroughly. The correct answer is D. Dispense a limited emergency supply of the controlled substance based on professional judgment and document the circumstances thoroughly. Explanation. This scenario presents a professional challenge because it requires the pharmacist to exercise independent judgment within the defined scope of practice, balancing patient needs with legal and ethical obligations. The pharmacist must assess whether the requested action falls within their authority to provide direct patient care, or if it necessitates a referral to a physician. The correct approach represents best professional practice because it adheres strictly to the established scope of practice for pharmacists as defined by the Multistate Pharmacy Jurisprudence Examination (MPJE) regulatory framework. This framework emphasizes patient safety and ensures that pharmacists act within their competency and legal authority. By consulting the relevant state statutes and Board of Pharmacy regulations, the pharmacist can definitively determine if the proposed intervention is permissible. If it is, the pharmacist can proceed with appropriate patient counseling and management. If it is not, the pharmacist must ethically and professionally refer the patient to a physician, ensuring continuity of care and avoiding the unauthorized practice of medicine. This approach prioritizes patient well-being by ensuring interventions are performed by the appropriately licensed and qualified healthcare professional. An incorrect approach would be to unilaterally decide to perform the requested intervention without verifying its legality and appropriateness within the pharmacist's scope of practice. This could lead to the unauthorized practice of medicine, which is a serious regulatory and ethical violation. It undermines the established division of responsibilities among healthcare professionals and could result in patient harm if the pharmacist lacks the necessary diagnostic or prescriptive authority. Another incorrect approach would be to dismiss the patient's request outright without exploring whether any part of their need can be addressed within the pharmacist's scope, such as providing general health information or recommending over-the-counter options if appropriate. This fails to meet the professional obligation to assist patients to the fullest extent of one's licensure. The professional decision-making process in such situations involves a systematic evaluation. First, understanding the patient's request and underlying need. Second, consulting the specific state's pharmacy laws and regulations to determine the pharmacist's scope of practice regarding that request. Third, assessing if the pharmacist possesses the necessary knowledge, skills, and legal authority to perform the requested action. And fourth, acting in accordance with these findings, which may involve providing care, offering counseling, or referring the patient to another healthcare provider. Question 6. Cost-benefit analysis shows that implementing stricter verification protocols for controlled substance prescriptions, particularly those for Schedule Roman II opioids exceeding typical dosage ranges or presented under unusual circumstances, can significantly reduce diversion and associated societal costs. Pharmacist receives a prescription for a Schedule Roman II opioid for a quantity that is unusually large for the patient's stated condition, and the patient is evasive when asked about the specific reason for the dosage. Which of the following actions best balances patient access with regulatory compliance and public safety? Option A. Dispense the prescription as written, assuming the prescriber has a valid medical reason for the dosage. Option B. Refuse to dispense the medication and immediately contact local law enforcement to report the patient. Option C. Contact the prescribing physician's office to verify the prescription's legitimacy, confirm the dosage, and clarify the medical necessity. Option D. Dispense a smaller, more standard quantity of the medication and instruct the patient to return for the remainder. The correct answer is C. Contact the prescribing physician's office to verify the prescription's legitimacy, confirm the dosage, and clarify the medical necessity. Explanation. This scenario presents a professional challenge due to the inherent tension between patient access to necessary medication and the legal mandate to prevent diversion and abuse of controlled substances. A pharmacist must exercise careful judgment to balance these competing interests, adhering strictly to state-specific controlled substance regulations. The correct approach represents best professional practice because it prioritizes patient safety and legal compliance. By directly contacting the prescriber to verify the legitimacy of the prescription and to clarify any potential ambiguities, the pharmacist fulfills their duty of care. This action is directly supported by state pharmacy practice acts and controlled substance regulations, which often require pharmacists to exercise professional judgment and take reasonable steps to ensure the validity of controlled substance prescriptions. This includes verifying the prescriber's identity, the patient's identity, and the medical necessity of the prescription, especially when red flags are present. Ethically, this approach upholds the pharmacist's role as a gatekeeper of controlled substances, safeguarding public health. An incorrect approach that involves dispensing the prescription without further inquiry, despite the unusual quantity and the patient's stated reason, represents a significant regulatory and ethical failure. This failure stems from a disregard for the pharmacist's responsibility to identify and address potential prescription fraud or abuse. Such an action could lead to the diversion of controlled substances, contributing to addiction and public health crises, and would violate state laws governing the dispensing of controlled substances. Another incorrect approach, that of refusing to dispense and immediately reporting the patient to law enforcement without attempting to verify the prescription with the prescriber, is also professionally unacceptable. While reporting suspicious activity is important, bypassing the opportunity to clarify the prescription with the prescriber can be detrimental to a patient who may have a legitimate medical need. This approach fails to exercise due diligence in verifying the prescription's legitimacy and may unnecessarily jeopardize a patient's access to essential medication, potentially violating the principle of beneficence. It also bypasses a crucial step in the professional verification process. A further incorrect approach, that of dispensing a reduced quantity and advising the patient to return for the remainder, is problematic because it still dispenses a controlled substance without full verification. While it might seem like a compromise, it still involves dispensing a potentially illegitimate prescription and does not fully address the underlying concern of prescription validity. This approach fails to fully comply with the requirement to ensure the prescription is legitimate before dispensing any quantity. The professional reasoning process for similar situations should involve a systematic approach. 1. Identify red flags. Recognize any unusual aspects of the prescription, patient behavior, or request. 2. Consult regulations. Immediately refer to state-specific controlled substance laws and regulations for guidance on dispensing requirements and pharmacist responsibilities. 3. Exercise professional judgment. Evaluate the identified red flags in the context of the regulations and the pharmacist's knowledge of the patient and prescriber. 4. Take appropriate action. This may involve verifying the prescription with the prescriber, requesting identification, documenting the interaction, or refusing to dispense if suspicion of fraud or abuse remains high. 5. Document thoroughly. Maintain detailed records of all actions taken, communications, and decisions made. Question 7. Operational review demonstrates that a company is marketing a product labeled as a nutritional supplement that contains several botanical extracts. The product's promotional materials and website claim that it supports healthy joint function, reduces occasional stiffness, and promotes cartilage health. Based on the Food, Drug, and Cosmetic Act, how should a pharmacist evaluate this product's regulatory status? Option A. Advise consumers that products making such claims are generally safe and effective for their intended purpose, regardless of regulatory classification. Option B. Consider the product a dietary supplement as long as it does not contain any prescription drug ingredients. Option C. Accept the product's self-classification as a dietary supplement and assume it complies with all relevant regulations. Option D. Determine if the product's claims suggest an intent to diagnose, cure, mitigate, treat, or prevent disease, or affect the structure or function of the body in a manner that would classify it as a drug. The correct answer is D. Determine if the product's claims suggest an intent to diagnose, cure, mitigate, treat, or prevent disease, or affect the structure or function of the body in a manner that would classify it as a drug. Explanation. Scenario analysis. This scenario presents a challenge in distinguishing between a dietary supplement and a drug based on its claims and intended use, which is a critical distinction under the Food, Drug, and Cosmetic Act, FDCA. Misclassifying a product can lead to significant regulatory consequences, including product seizure, injunctions, and penalties, as well as potential harm to consumers who may rely on the product for therapeutic purposes without proper oversight. The pharmacist's role is to ensure that products dispensed or recommended are safe and effective for their intended use and comply with federal law. Correct approach analysis. The correct approach involves a thorough evaluation of the product's labeling, marketing materials, and intended use against the definitions and criteria established by the FDCA. Specifically, if the product is marketed with claims to diagnose, cure, mitigate, treat, or prevent disease, or if it affects the structure or function of the body in a way that suggests a therapeutic intent, it is likely considered a drug. The FDCA requires drugs to undergo pre-market approval by the FDA, including rigorous testing for safety and efficacy. Therefore, identifying a product as a drug based on its claims and initiating the appropriate regulatory pathway or advising the manufacturer accordingly is the best professional practice, ensuring consumer safety and legal compliance. Incorrect approach is analysis. One incorrect approach is to assume that because a product is marketed as a dietary supplement, it automatically falls outside the purview of drug regulations. This fails to recognize that the FDCA definition of a drug is based on its intended use and claims, not solely on its classification by the manufacturer. If the claims made for the supplement are drug-like, it must be regulated as a drug, regardless of its labeling. Another incorrect approach is to dismiss the product's claims as mere marketing puffery without a careful regulatory assessment. The FDCA scrutinizes claims to determine their impact on the product's classification. Ignoring potentially therapeutic claims can lead to the illegal marketing of unapproved drugs. A third incorrect approach is to recommend the product to consumers for specific health conditions without verifying its regulatory status. This exposes the pharmacist to liability and potentially misleads consumers into using a product that has not been proven safe or effective for their condition. Professional reasoning. Professionals should adopt a systematic approach when evaluating products that blur the lines between dietary supplements and drugs. This involves 1. carefully reviewing all product labeling and marketing materials for claims related to disease treatment, prevention, or alteration of bodily structure/function. 2. Consulting the definitions of drug and dietary supplement within the FDCA and relevant FDA guidance documents. 3. If drug-like claims are present, considering the product's potential classification as an unapproved new drug. 4. Seeking guidance from regulatory affairs experts or legal counsel if the classification is unclear. 5. Prioritizing consumer safety and regulatory compliance above all else. Question 8. The evaluation methodology shows that a community pharmacy has identified a recurring risk of dispensing errors, particularly during peak operational hours. The pharmacist on duty is responsible for overseeing the entire dispensing process, from prescription entry to final verification. Which of the following approaches best mitigates this identified risk while adhering to professional standards and regulatory requirements? Option A. Establish a system where the pharmacist performs a thorough review of all prescriptions, including a double check of drug, dose, and directions, and utilizes technology such as barcode scanning for verification. Option B. Delegate the final accuracy check of all prescriptions to the pharmacist's assistant, trusting their familiarity with common medications and dosages. Option C. Implement a mandatory second verification step by a qualified pharmacy technician for all prescriptions before they are handed to the patient, with the pharmacist performing a final review of high-risk medications. Option D. Rely on the pharmacist's experience and a single visual check of the prescription label against the dispensed medication before patient release, assuming efficient workflow is paramount. The correct answer is C. Implement a mandatory second verification step by a qualified pharmacy technician for all prescriptions before they are handed to the patient, with the pharmacist performing a final review of high-risk medications. Explanation: this scenario presents a professional challenge due to the inherent risk of medication errors in a busy pharmacy setting, compounded by the need to maintain patient safety while optimizing workflow. The pharmacist must balance efficiency with the absolute requirement for accuracy in dispensing. Careful judgment is required to identify and mitigate potential sources of error without unduly hindering the pharmacy's ability to serve its patient population. The correct approach represents best professional practice because it directly addresses the identified risk of dispensing errors through a multi-layered system of checks and balances, aligning with the fundamental principles of patient safety and regulatory compliance. This approach prioritizes verification at critical junctures of the dispensing process, ensuring that the right drug, at the right dose, for the right patient, is dispensed. This aligns with the pharmacist's ethical and legal responsibility to ensure the quality and safety of dispensed medications, as mandated by pharmacy practice acts and professional standards that emphasize due diligence and error prevention. An incorrect approach that relies solely on the pharmacist's memory or a single check before dispensing is professionally unacceptable. This fails to acknowledge the high cognitive load and potential for distraction in a pharmacy environment, significantly increasing the risk of dispensing errors. Such an approach violates the principle of due diligence and the expectation of robust quality control measures, potentially leading to patient harm and regulatory sanctions for failing to implement adequate safeguards. Another incorrect approach that delegates the final verification of a prescription to a technician without pharmacist oversight is also professionally unacceptable. While technicians play a vital role in pharmacy operations, the final responsibility for ensuring the accuracy and appropriateness of a dispensed prescription rests with the licensed pharmacist. This delegation bypasses a critical safety check and contravenes regulations that require pharmacist final verification of prescription. A third incorrect approach that focuses solely on speed of dispensing without incorporating systematic error-checking mechanisms is fundamentally flawed. While efficiency is desirable, it must never come at the expense of patient safety. This approach prioritizes throughput over accuracy, creating an environment ripe for errors and demonstrating a disregard for the pharmacist's primary duty to protect patients from harm. The professional decision-making process for similar situations should involve a systematic risk assessment of pharmacy operations. This includes identifying potential points of failure in the dispensing process, evaluating the likelihood and severity of associated risks, and implementing appropriate control measures. Professionals should consult relevant state board of pharmacy regulations, professional guidelines, and best practices for medication error prevention. A proactive approach, emphasizing a culture of safety and continuous improvement, is essential for maintaining high standards of patient care. Question 9. The control framework reveals that a pharmacist receives a prescription for a Schedule II controlled substance. Upon reviewing the prescription, the pharmacist notes that the patient is a new individual to the pharmacy. The dosage appears higher than typically prescribed for the indicated condition, and the prescriber's address is out of state, which is unusual for this patient's known residence. The pharmacist is aware of the state's Prescription Drug Monitoring Program, PDMP, requirements for reporting controlled substance dispensations. Which of the following actions best adheres to state pharmacy laws and professional best practices? Option A. Dispense the prescription immediately and report it to the PDMP as required by law. Option B. Dispense the prescription and then later attempt to verify its legitimacy with the prescriber. Option C. Contact the prescriber to verify the legitimacy of the prescription and its medical necessity before dispensing, and then report to the PDMP if dispensed. Option D. Refuse to dispense the prescription without further investigation, citing the unusual circumstances. The correct answer is A. Dispense the prescription immediately and report it to the PDMP as required by law. Explanation. The control framework reveals a scenario where a pharmacist must balance patient privacy with the legal requirements for reporting controlled substance prescriptions. This situation is professionally challenging because it involves interpreting and applying state pharmacy laws regarding controlled substances, specifically the circumstances under which a prescription must be reported to the state's Prescription Drug Monitoring Program, PDMP. The pharmacist must ensure compliance with the law while also safeguarding patient confidentiality, a core ethical principle. The correct approach represents best professional practice because it directly addresses the legal mandate for reporting controlled substance prescriptions to the PDMP. State pharmacy laws, such as those governing PDMP, are designed to track the dispensing of controlled substances to prevent diversion, abuse, and overutilization. By verifying the prescription's legitimacy and then reporting it as required by law, the pharmacist fulfills their legal obligation and contributes to public health and safety initiatives. This action aligns with the pharmacist's role as a gatekeeper of controlled substances and their responsibility to uphold the law. An incorrect approach that involves simply dispensing the prescription without verifying its legitimacy or reporting it to the PDMP fails to comply with state laws. This constitutes a regulatory failure, as it bypasses a critical mechanism for monitoring controlled substance use. Ethically, it could be seen as a failure to act in the best interest of public health by not participating in a system designed to prevent harm. Another incorrect approach, which involves refusing to dispense the prescription solely based on a suspicion of diversion without further investigation or consultation with the prescriber, might be overly cautious and could negatively impact a patient who has a legitimate need for the medication. Vigilance is important. A blanket refusal without due diligence could violate the pharmacist's duty to provide care. This approach fails to engage in the necessary professional judgment and communication required by state pharmacy practice acts, which often mandate consultation with the prescriber in ambiguous situations. A third incorrect approach, which involves reporting the prescription to the PDMP, but failing to verify its legitimacy with the prescriber when there are clear red flags, is also a regulatory and ethical failure. While reporting is a requirement, the pharmacist's primary responsibility is to ensure the prescription is valid before dispensing. Ignoring suspicious elements and solely relying on the reporting mechanism does not fulfill the pharmacist's duty to prevent dispensing fraudulent or inappropriate prescriptions. The professional decision-making process for similar situations should involve a systematic evaluation. 1. Identify the prescription type. Is it a controlled substance? 2. Assess the prescription for red flags. Does it appear legitimate based on prescriber-patient dosage and quantity? 3. Consult state laws and regulations. What are the specific reporting requirements for this controlled substance to the PDMP? Are there any exemptions? 4. If red flags exist, engage in due diligence. Contact the prescriber to verify the prescription's authenticity and medical necessity. 5. If the prescription is verified as legitimate, proceed with dispensing and fulfill all reporting requirements. 6. If the prescription is deemed fraudulent or medically unnecessary after due diligence, refuse to dispense and report the incident to the appropriate authorities as per state law. Question 10. The audit findings indicate a pattern of prescriptions for controlled substances that, while appearing to be within standard dosing, were written for patients with multiple prescribers and pharmacies, raising concerns about potential diversion or misuse. The pharmacist on duty identified one such prescription for a patient known to have a history of substance abuse. What is the most appropriate course of action for the pharmacist in this situation, considering their role in patient care and regulatory compliance? Option A. Refuse to fill the prescription immediately and advise the patient to seek care elsewhere. Option B. Contact the patient directly to inquire about their use of other pharmacies and prescribers before speaking with the physician. Option C. Contact the prescribing physician to verify the legitimacy of the prescription and discuss the patient's history and the pharmacist's concerns. Option D. Dispense the prescription as written, assuming the prescriber has a valid clinical reason for the order. Correct answer is C. Contact the prescribing physician to verify the legitimacy of the prescription and discuss the patient's history and the pharmacist's concerns. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the pharmacist to balance patient safety, legal compliance, and professional judgment when faced with a potentially inappropriate prescription. The pharmacist must assess the risk to the patient, the prescriber's intent, and the available information to make a decision that upholds their responsibility as a medication expert and patient advocate. The audit findings add a layer of scrutiny, emphasizing the need for meticulous documentation and adherence to established protocols. Correct approach analysis. The correct approach involves direct communication with the prescriber to clarify the prescription. This aligns with the pharmacist's role in patient care, as defined by the Multistate pharmacy jurisprudence examinations, focus on ensuring safe and effective medication use. Regulations emphasize the pharmacist's duty to verify the legitimacy and appropriateness of prescriptions. By contacting the prescriber, the pharmacist can gather necessary information, identify potential errors or misunderstandings, and ensure the patient receives the correct therapy. This proactive step prevents potential harm and upholds the pharmacist's professional responsibility to the patient. Incorrect approach is analysis. Refusing to fill the prescription without attempting to contact the prescriber is an incorrect approach because it fails to exhaust all avenues for clarification and may unnecessarily disrupt patient care. While patient safety is paramount, a complete refusal without inquiry can be seen as an abdication of the pharmacist's role in collaborative practice and problem-solving. Dispensing the prescription as written without any further inquiry, despite the pharmacist's concerns, is a significant regulatory and ethical failure. This directly contravenes the pharmacist's responsibility to ensure the safety and efficacy of dispensed medications. It prioritizes expediency over patient well-being and ignores the pharmacist's professional judgment. Contacting the patient to question the prescription before speaking with the prescriber is also an incorrect approach. While patient input is valuable, directly questioning the patient about a prescriber's order without first consulting the prescriber can undermine the prescriber-patient relationship and may not provide the pharmacist with the complete clinical context needed to make an informed decision. The prescriber is the primary source for clarifying their intent. Professional reasoning. When faced with a questionable prescription, a pharmacist should follow a systematic decision-making process. 1. Assess the prescription for obvious errors or inconsistencies. 2. Consult available resources, drug information databases, formularies for relevant information. 3. If concerns persist, prioritize direct communication with the prescriber to clarify the order. 4. Document all communications and decisions thoroughly. 5. If clarification cannot be obtained or the prescriber's response remains concerning, involve the patient in the discussion and consider alternative actions, including refusal to dispense if patient safety is compromised. Question 11. The risk matrix shows a moderate probability of a significant adverse drug event if a patient's prescribed medication is dispensed at a higher dosage than clinically recommended, based on the patient's stated desire to achieve faster symptom relief. The pharmacist has concerns about the safety and efficacy of this dosage adjustment without prescriber consultation. What is the most appropriate course of action for the pharmacist? Option A. Engage in a detailed discussion with the patient to understand their rationale for the requested dosage. Educate them on the potential risks and benefits of the prescribed versus the requested dosage, and explore alternative strategies, including consulting with the prescriber, to ensure optimal and safe therapy. Option B. Dispense the medication at the prescribed dosage, but do not counsel the patient on the requested dosage or the potential risks, as the prescription was valid as written. Option C. Dispense the medication at the higher dosage requested by the patient to immediately address their perceived need for faster relief, assuming the patient is making an informed decision. Option D. Refuse to dispense the medication at the higher dosage and inform the patient that they must obtain a new prescription from their prescriber for the requested dosage, without further discussion or exploration of alternatives. The correct answer is A. Engage in a detailed discussion with the patient to understand their rationale for the requested dosage, educate them on the potential risks and benefits of the prescribed versus the requested dosage, and explore alternative strategies, including consulting with the prescriber, to ensure optimal and safe therapy. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between patient autonomy and the pharmacist's professional responsibility to ensure safe and effective medication use. The patient's insistence on a specific dosage, despite the pharmacist's clinical concerns, requires careful navigation to uphold both patient rights and professional standards. The pharmacist must balance providing patient-centered care with their duty to prevent harm, as mandated by pharmacy practice standards. Correct approach analysis. The correct approach involves a comprehensive discussion with the patient, exploring the rationale behind their request and educating them on the potential risks associated with the higher dosage. This aligns with the principles of informed consent and patient counseling, which are fundamental to pharmacy practice. By offering alternative solutions, such as consulting with the prescriber or exploring different therapeutic options, the pharmacist demonstrates a commitment to patient safety and collaborative care. This approach respects the patient's role in their treatment, while ensuring that clinical judgment is applied to mitigate potential harm, consistent with the pharmacist's professional obligations under state and federal regulations governing pharmacy practice. Incorrect approaches analysis. One incorrect approach involves immediately dispensing the medication as requested without further discussion. This fails to meet the pharmacist's professional responsibility to counsel patients on appropriate medication use and potential risks. It could lead to adverse drug events, violating the duty of care, and potentially breaching regulations related to dispensing practices and patient safety. Another incorrect approach is to refuse to dispense the medication outright and dismiss the patient's request without attempting to understand their perspective or explore alternatives. This demonstrates a lack of patient-centered care and can erode the patient-pharmacist relationship. Ethically, it may be considered a failure to provide adequate care and could violate professional standards that emphasize communication and collaboration. A third incorrect approach is to dispense the medication but fail to document the conversation or the rationale for dispensing. This omission creates a gap in the patient's record and can hinder future care. It also fails to provide a defense for the pharmacist if an adverse event occurs, potentially violating record-keeping requirements and professional accountability standards. Professional reasoning. Professionals should approach such situations by first actively listening to the patient's concerns and understanding their perspective. This should be followed by a thorough clinical assessment, including reviewing the patient's profile and the prescribed medication. The next step is to engage in open and honest communication, explaining clinical concerns clearly and offering evidence-based alternatives. If consensus cannot be reached, consulting with the prescriber is a crucial step to ensure the best outcome for the patient. Documentation of all interactions and decisions is paramount for accountability and continuity of care. Question 12. Governance review demonstrates that a pharmaceutical representative has gifted a pharmacist a high-value item shortly before a patient inquires about a new, expensive brand-name medication that the representative's company manufactures. The patient asks the pharmacist for their opinion on this medication compared to a less expensive generic alternative. What is the most ethically sound and professionally responsible course of action for the pharmacist? Option A. The pharmacist should refuse to discuss the medication with the patient, citing the potential conflict of interest created by the gift, and suggest the patient consult their physician. Option B. The pharmacist should accept the gift and subtly emphasize the perceived benefits of the brand-name medication to the patient, aligning their recommendation with the potential for future gifts or incentives. Option C. The pharmacist should acknowledge the gift but proceed to provide the patient with a comprehensive and unbiased comparison of the brand-name medication and the generic alternative, including information on efficacy, side effects, and cost, without mentioning the gift or allowing it to influence their recommendation. Option D. The pharmacist should immediately return the gift to the pharmaceutical representative and then provide the patient with an unbiased comparison of the medications. The correct answer is C. The pharmacist should acknowledge the gift but proceed to provide the patient with a comprehensive and unbiased comparison of the brand name medication and the generic alternative, including information on efficacy, side effects, and cost, without mentioning the gift or allowing it to influence their recommendation. Explanation. This scenario presents a professional challenge due to the inherent conflict between a pharmacist's duty to patient well-being and the potential for financial gain, or maintaining a professional relationship. The pharmacist must navigate the ethical imperative of providing unbiased, patient-centered care, while also considering the implications of their actions on their professional standing and the patient's trust. Careful judgment is required to ensure that all decisions are rooted in the patient's best interest and adhere to established professional standards. The correct approach represents best professional practice because it prioritizes patient autonomy and informed consent. By directly addressing the patient's request with factual information about the medication's availability and cost, and offering alternatives without coercion, the pharmacist upholds the ethical principles of beneficence, non-maleficence, and justice. This approach aligns with the Multistate Pharmacy Jurisprudence examination's emphasis on patient advocacy and the pharmacist's role as a trusted healthcare provider, ensuring that the patient can make an informed decision based on accurate and complete information, free from undue influence. An incorrect approach that involves accepting the gift and then subtly steering the patient towards the more expensive medication fails to uphold professional integrity. This constitutes a breach of ethical conduct by creating a conflict of interest and potentially compromising the pharmacist's objectivity. The pharmacist's primary obligation is to the patient's health and financial well-being, not to personal gain or the interests of a pharmaceutical representative. Such an action erodes patient trust and violates the principle of acting solely in the patient's best interest. Another incorrect approach, which is to refuse to discuss the medication at all due to the gift, is also professionally unacceptable. While it attempts to avoid a conflict of interest, it fails to meet the pharmacist's professional responsibility to provide necessary information and counseling to patients. Patients have a right to inquire about medication, and pharmacists have a duty to respond truthfully and comprehensively. This approach neglects the patient's need for information and can be perceived as dismissive, hindering effective patient care and communication. The professional decision-making process for similar situations should involve a clear ethical framework. First, identify the ethical principles at play, e.g., patient autonomy, beneficence, non-maleficence, integrity. Second, assess the potential conflicts of interest and their impact on patient care. Third, gather all relevant factual information about the medication, its alternatives, and any associated costs or benefits. Fourth, communicate openly and honestly with the patient, providing unbiased information and counseling. Fifth, document the interaction and decision-making process. Finally, if a conflict of interest is unavoidable or perceived, consider seeking guidance from professional organizations or supervisors. Question 13. Cost-benefit analysis shows that implementing a fully electronic auditable prescription and dispensing record system with automated backup and retrieval features requires significant upfront investment and ongoing maintenance. However, a less robust, partially paper-based system with manual log entries for certain transactions is less expensive to maintain. Considering the Multistate Pharmacy Jurisprudence examination's emphasis on regulatory compliance, which approach best aligns with best professional practice for record keeping. Option A. Adopt the less expensive, partially paper-based system, as the cost savings are substantial and the risk of significant regulatory issues is perceived as low for routine pharmacy operations. Option B. Focus on maintaining only the minimum legally required records, regardless of the system used, to minimize administrative overhead and associated costs. Option C. Implement a hybrid system that digitizes some records, but relies on manual, paper-based logs for a significant portion of transactions to balance cost and perceived compliance needs. Option D. Prioritize the fully electronic auditable system, recognizing that the long-term benefits of enhanced compliance, patient safety, and reduced risk of regulatory penalties outweigh the initial and ongoing costs. The correct answer is D. Prioritize the fully electronic auditable system, recognizing that the long-term benefits of enhanced compliance, patient safety, and reduced risk of regulatory penalties outweigh the initial and ongoing costs. Explanation. This scenario presents a common challenge in pharmacy practice, balancing efficiency with the absolute necessity of accurate and complete record-keeping, as mandated by the Multistate Pharmacy Jurisprudence examinations governing regulations. The core tension lies in the potential for time saving versus the risk of regulatory noncompliance and patient safety compromise. The correct approach prioritizes adherence to the specific record-keeping requirements outlined by the relevant state pharmacy laws and federal regulations. This is best professional practice because these regulations are designed to ensure accountability, facilitate drug diversion investigations, support clinical decision-making, and protect public health. Maintaining detailed and accessible records, even if it requires more initial effort, ultimately provides a robust system that minimizes legal and ethical risks. It allows for efficient retrieval of information when needed for audits, patient care inquiries, or legal proceedings, thereby demonstrating due diligence and professional responsibility. An incorrect approach that relies on informal or incomplete documentation, such as relying solely on verbal agreements or incomplete logs, fails to meet the minimum legal standards for record keeping. This creates significant regulatory risk, as it can lead to fines, disciplinary actions, and even license suspension or revocation. Ethically, it compromises patient safety by making it difficult to track medication history, identify potential drug interactions, or verify dispensing accuracy. Another incorrect approach might involve digitizing records without ensuring their integrity, security, or accessibility in a format compliant with regulations. This could lead to data loss, unauthorized access, or an inability to produce records upon request, all of which are serious regulatory violations. Professionals should approach record-keeping by first thoroughly understanding the specific requirements of their jurisdiction, including what information must be recorded, how long it must be retained, and in what format. They should then implement systems and workflows that consistently meet these requirements, viewing them not as a burden, but as an integral part of safe and effective patient care and professional accountability. Regular training and audits of record-keeping practices are essential to ensure ongoing compliance and identify areas for improvement. Question 14. Compliance review shows a pharmacist received a prescription for a Schedule II controlled substance. Upon review, the pharmacist notes that the prescribed dosage appears unusually high for the patient's stated condition, and the prescriber's signature is slightly different from previous prescriptions on file. What is the most appropriate course of action for the pharmacist? Option A. Ask the patient to explain the discrepancy in dosage and signature. Option B. Refuse to fill the prescription and inform the patient that the signature appears irregular. Option C. Contact the prescribing practitioner directly to verify the prescription details and clarify the dosage. Option D. Dispense the prescription as written, assuming the prescriber made a conscious decision regarding the dosage. The correct answer is C. Contact the prescribing practitioner directly to verify the prescription details and clarify the dosage. Explanation. Scenario analysis. This scenario presents a challenge due to the inherent risks associated with controlled substances, including diversion, misuse, and potential harm to patients. The pharmacist must balance the legitimate medical needs of patients with the strict legal and ethical obligations to safeguard these medications. The discrepancy in prescription details necessitates careful investigation to ensure patient safety and regulatory compliance without unduly hindering access to necessary treatment. Correct approach analysis. The correct approach involves verifying the prescription's legitimacy directly with the prescribing practitioner. This aligns with federal and state controlled substance regulations, such as the Controlled Substances Act, CSA, and corresponding state pharmacy laws, which mandate that pharmacists exercise due diligence in dispensing controlled substances. Direct communication allows the pharmacist to clarify any discrepancies, confirm the patient's medical necessity, and ensure the prescription is valid and safe to dispense. This proactive step protects both the patient and the public from potential harm and prevents regulatory violations. Incorrect approach is analysis. One incorrect approach is to dispense the prescription as written without further inquiry. This fails to address the potential for error or fraud, violating the pharmacist's professional responsibility to ensure the accuracy and legitimacy of controlled substance prescriptions. It could lead to dispensing an incorrect dosage or a medication not intended for the patient, posing a direct risk to patient safety and violating dispensing regulations. Another incorrect approach is to immediately refuse to fill the prescription and inform the patient that the prescription is invalid. Caution is necessary. An outright refusal without attempting to verify the information can be detrimental to the patient's health, especially if the discrepancy is a simple error. This approach bypasses the opportunity to resolve the issue through professional communication and could be seen as an abdication of the pharmacist's role in patient care and medication management. A third incorrect approach is to contact the patient to inquire about the discrepancy. While patient interaction is important, asking the patient to explain a discrepancy on a controlled substance prescription can inadvertently solicit information that could be used for illicit purposes or place the patient in an uncomfortable or incriminating position. The primary responsibility for verifying prescription accuracy lies with the pharmacist and the prescriber, not the patient, especially when dealing with controlled substances. Professional reasoning. When faced with a potential discrepancy in a controlled substance prescription, a pharmacist should employ a systematic approach. First, identify the specific discrepancy. Second, consult relevant regulations and pharmacy policies. Third, prioritize direct communication with the prescribing practitioner to clarify the issue. Fourth, if clarification is successful and the prescription is deemed valid, proceed with dispensing. If the discrepancy cannot be resolved or raises significant concerns, the pharmacist should document their actions and consult with their supervisor or the relevant regulatory board. This process ensures patient safety, maintains legal compliance, and upholds professional integrity. Question 15. Risk assessment procedures indicate that a prescription for a Schedule II controlled substance is missing the patient's full address. The pharmacist has the prescriber's name, DEA number, drug name, strength, dosage form, quantity, and directions for use. What is the most appropriate course of action? Option A. Contact the prescriber to obtain the patient's full address. Option B. Assume the patient's address based on previous prescriptions for the same patient. Option C. Contact the patient to obtain their full address before contacting the prescriber. Option D. Dispense the prescription and attempt to obtain the patient's address from the patient at a later time. The correct answer is A. Contact the prescriber to obtain the patient's full address. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for a prescription to be incomplete or ambiguous, which could lead to dispensing errors, patient harm, or diversion of controlled substances. The pharmacist must exercise sound professional judgment to ensure the prescription meets all legal requirements for validity and safety, while also respecting the prescriber's intent and the patient's needs. The pharmacist's responsibility extends beyond simply filling a request. It involves a critical evaluation of the information provided. Correct approach analysis. The correct approach involves contacting the prescriber to clarify the missing information. This action directly addresses the identified deficiency in the prescription, ensuring compliance with federal and state laws governing prescription requirements, such as those outlined by the U.S. Drug Enforcement Administration (D) and state pharmacy boards. Specifically, a valid prescription must contain the patient's full name and address, drug name, strength, dosage form, quantity, directions for use, and the prescriber's name, address, and signature. Obtaining this missing information from the prescriber is the most direct and legally sound method to validate the prescription before dispensing, thereby protecting the patient and upholding professional standards. Incorrect approach is analysis. Dispensing the prescription without the patient's address would be a direct violation of federal and state regulations that mandate this information for identification and record-keeping purposes. This omission creates a significant risk of dispensing to the wrong patient or facilitating diversion. Assuming the patient's address or using a previous record without verification is also problematic, as patient information can change, and such assumptions bypass the legal requirement for current, accurate data on the prescription itself. Attempting to contact the patient to obtain the address before contacting the prescriber is less ideal because the primary responsibility for the completeness of the prescription lies with the prescriber. While patient information is crucial, the initial validation of the prescription's legal sufficiency rests with the pharmacist's interaction with the prescriber. Professional reasoning. When faced with an incomplete prescription, a pharmacist should first identify the specific missing or ambiguous elements. Then, they should consult relevant federal and state laws and regulations to understand the legal requirements for a valid prescription. The primary course of action should be to contact the prescriber to obtain the necessary clarification or missing information. This ensures the prescription is legally valid and safe for dispensing. If the prescriber cannot be reached, the pharmacist must then consider alternative actions based on state-specific emergency dispensing protocols, or consult with their supervising pharmacist or board of pharmacy for guidance, always prioritizing patient safety and legal compliance. Question 16. Quality control measures reveal a discrepancy of 1 tablet of a Schedule Roman IV controlled substance during a routine biennial inventory count. The prescription records indicate that the correct number of tablets should be present. The pharmacist on duty is the only individual who has had access to the controlled substance cabinet since the last inventory. What is the most appropriate immediate action for the pharmacist to take? Option A. Conduct a thorough physical recount of the specific controlled substance and review all dispensing records for that medication since the last inventory to identify the source of the discrepancy. Option B. Adjust the inventory record to reflect the physical count, assuming a minor counting error occurred during the initial inventory. Option C. Document the discrepancy and address it during the next scheduled inventory audit. Option D. Immediately report the missing tablet to the Drug Enforcement Administration, D, as a potential diversion. The correct answer is A. Conduct a thorough physical recount of the specific controlled substance and review all dispensing records for that medication since the last inventory to identify the source of the discrepancy. Explanation. This scenario presents a professional challenge due to the potential for a medication error that could impact patient safety. The pharmacist must balance the immediate need to address the discrepancy with the established procedures for handling controlled substances, ensuring both compliance and patient well-being. Careful judgment is required to determine the most appropriate course of action without compromising the integrity of the inventory or the security of the controlled substance. The correct approach represents best professional practice because it directly addresses the regulatory requirement for accurate controlled substance inventory. State Board of Pharmacy regulations, such as those found in the Model Pharmacy Act and model regulations, mandate meticulous record-keeping for controlled substances. Promptly investigating and documenting any discrepancy, including a physical count and a review of dispensing records, is crucial for maintaining compliance and identifying potential diversion or errors. This proactive approach ensures that any issues are identified and rectified swiftly, minimizing risk to patients and the pharmacy. An incorrect approach that involves simply adjusting the inventory to match the prescription without further investigation fails to comply with regulations requiring an accurate accounting of all controlled substances. This could mask a diversion or a dispensing error, leading to future discrepancies and potential legal ramifications. Another incorrect approach, such as immediately reporting a minor discrepancy to the DEA without internal investigation, may be premature and could lead to unnecessary regulatory scrutiny. While reporting is essential for significant losses, initial internal verification is the standard first step. Finally, ignoring the discrepancy until the next scheduled inventory is a clear violation of regulations requiring ongoing, accurate inventory control and could allow a problem to escalate. Professionals should employ a decision-making framework that prioritizes patient safety and regulatory compliance. This involves 1. Recognizing the discrepancy and its potential implications. 2. Initiating immediate internal investigation, including a physical count and record review. 3. Documenting all findings meticulously. 4. Consulting relevant state and federal regulations regarding controlled substance inventory and reporting requirements. 5. Taking appropriate corrective action based on the findings and regulatory guidance, which may include reporting to the Board of Pharmacy or DEA if necessary. Question 17. Strategic planning requires a pharmacist to anticipate and address potential ethical dilemmas. A patient presents to the pharmacy requesting a refill of a controlled substance medication. The patient states their physician is out of town and they have run out of their medication, claiming it is an emergency. The patient has a history of controlled substance abuse. What is the most ethically and legally sound approach for the pharmacist to take? Option A. Contact the patient's physician to verify the prescription and discuss the patient's request for an emergency refill or contact another prescriber to obtain a new prescription if direct physician contact is not possible. Option B. Dispense the medication based on the patient's word, assuming they are telling the truth about the emergency and their physician's unavailability. Option C. Dispense a limited emergency supply of the controlled substance, documenting the situation thoroughly and advising the patient to see their physician immediately upon their return. Option D. Refuse to dispense the medication, explaining that a valid prescription is required for all controlled substances, and advise the patient to seek immediate medical attention from another prescriber. The correct answer is C. Dispense a limited emergency supply of the controlled substance, documenting the situation thoroughly and advising the patient to see their physician immediately upon their return. Explanation. This scenario presents a professional challenge rooted in the inherent conflict between a pharmacist's duty to patient well-being and the potential for financial gain or convenience. The pharmacist must navigate the complex ethical landscape of patient autonomy, professional judgment, and the avoidance of conflicts of interest, all within the framework of the Multistate pharmacy jurisprudence examinations governing regulations and ethical codes. Careful judgment is required to uphold the highest standards of patient care and professional integrity. The correct approach represents best professional practice because it prioritizes the patient's immediate health needs and the pharmacist's professional responsibility to provide accurate and unbiased information. This aligns with the core ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, it adheres to the spirit of regulations that mandate pharmacists to act as patient advocates and to dispense medications only when a legitimate prescriber-patient relationship exists and a valid prescription is presented. The pharmacist's role is to ensure the safe and effective use of medication, which includes verifying the appropriateness of a prescription and addressing any potential concerns. An incorrect approach that involves dispensing a controlled substance without a valid prescription, even if the patient claims it's an emergency, represents a significant regulatory and ethical failure. This directly violates laws governing controlled substances, which require strict adherence to prescription requirements to prevent diversion and abuse. Ethically, it undermines the pharmacist's role as a gatekeeper of potentially dangerous medications and could lead to patient harm through inappropriate use or lack of proper medical oversight. Another incorrect approach, such as refusing to dispense a legitimately prescribed medication due to a personal belief about the patient's lifestyle choices, is also professionally unacceptable. This violates the principle of patient autonomy and non-discrimination. Pharmacists are ethically bound to treat all patients with respect and to dispense legally valid prescriptions without imposing their personal judgments. This action could also constitute a violation of state and federal anti-discrimination laws. A third incorrect approach, such as accepting a referral fee from a physician for prescribing a specific medication, creates a clear conflict of interest. This practice is generally prohibited by ethical codes and regulations designed to ensure that prescribing decisions are based solely on the patient's medical needs, not on financial incentives. Such an arrangement compromises the pharmacist's objectivity and erodes patient trust. The professional decision-making process for similar situations should involve a systematic evaluation of the ethical principles at play, relevant legal and regulatory requirements, and the potential impact on patient safety and trust. Pharmacists should always err on the side of caution when patient safety or regulatory compliance is in question. Consulting with supervisors, professional organizations, or legal counsel can be invaluable when facing complex ethical dilemmas. The ultimate goal is to uphold the pharmacist's commitment to patient well-being and the integrity of the profession. Question 18. Risk assessment procedures indicate a discrepancy between the recorded quantity of a Schedule II controlled substance in the perpetual inventory system and the actual physical count during a routine audit. The pharmacist on duty needs to dispense a prescription for this same controlled substance to a patient with a valid prescription. What is the most appropriate immediate course of action? Option A. Dispense the prescription and immediately conduct a full physical count of the controlled substance, documenting any findings and reporting the discrepancy to the DEA and State Pharmacy Board. Option B. Dispense the prescription, make a note of the discrepancy in the dispensing log, and initiate a full physical count of the controlled substance immediately after dispensing. Option C. Refuse to dispense the prescription until a complete physical count of the controlled substance is performed and the discrepancy is resolved, even if it means delaying patient care. Option D. Dispense the prescription, assuming the discrepancy is a minor clerical error, and address it during the next scheduled biennial inventory. The correct answer is B. Dispense the prescription, make a note of the discrepancy in the dispensing log, and initiate a full physical count of the controlled substance immediately after dispensing. Explanation: this scenario presents a professional challenge because it requires a pharmacist to balance the immediate need for a controlled substance with the regulatory imperative to maintain accurate and secure inventory records. The risk assessment highlights a potential vulnerability in the pharmacy system for tracking controlled substances, which could lead to diversion or loss. Careful judgment is required to address the immediate dispensing need without compromising the integrity of the inventory control system or violating federal and state regulations. The correct approach represents best professional practice because it prioritizes patient care while adhering strictly to the legal requirements for controlled substance inventory management. By immediately initiating a physical count of the specific controlled substance and documenting the discrepancy, the pharmacist is taking proactive steps to identify the source of the issue and comply with reporting obligations. This aligns with the DEA's regulations, 21 CFR Part 1304, which mandate accurate and complete inventories and prompt reporting of any loss or theft. This approach demonstrates due diligence and a commitment to regulatory compliance and patient safety. An incorrect approach that involves simply noting the discrepancy in the dispensing log without a physical count fails to meet the regulatory requirement for an accurate inventory. This could mask a larger issue and prevent timely detection of diversion. Another incorrect approach, such as delaying the physical count until the next scheduled inventory, violates the principle of prompt discrepancy investigation and reporting, increasing the risk of undetected diversion and potential legal repercussions. Finally, an approach that involves fabricating a count to match dispensing records is a severe ethical and legal violation, constituting falsification of records and potentially aiding in diversion. This directly contravenes the pharmacist's duty to maintain accurate records and uphold the law. Professionals should employ a decision-making framework that begins with identifying the core issue, a potential controlled substance discrepancy. Next, they must consult relevant regulations, State Pharmacy Board, to understand their obligations. The immediate priority is to secure the integrity of the inventory and patient safety. This involves taking immediate corrective action, such as a physical count, and documenting all steps taken. If a discrepancy is found, prompt reporting to the appropriate authorities, State Board, is mandatory. This systematic approach ensures compliance, protects the public, and maintains professional integrity. Question 19. Assessment of a pharmacy technician's appropriate response when a prescription is received for a pediatric patient that appears to have an adult dosage listed, and the technician is unsure if this is an intentional therapeutic choice or a prescribing error. Option A. The technician should consult with a more experienced pharmacy technician to determine the correct course of action. Option B. The technician should immediately alert the supervising pharmacist to the potential dosage discrepancy and await their direction. Option C. The technician should proceed with dispensing the medication as written, assuming the prescriber made an intentional choice. Option D. The technician should independently adjust the dosage to what they believe is appropriate for a pediatric patient based on general knowledge. The correct answer is B. The technician should immediately alert the supervising pharmacist to the potential dosage discrepancy and await their direction. Explanation: scenario analysis. This scenario presents a common implementation challenge in pharmacy practice, where a pharmacy technician is tasked with a responsibility that borders on or exceeds their defined scope of practice. The challenge lies in the technician's understanding of their limitations and the pharmacist's ultimate responsibility for patient care and drug dispensing. The technician must recognize when a task requires direct pharmacist intervention and cannot be delegated or completed independently. Correct approach analysis. The correct approach involves the pharmacy technician recognizing the potential for a medication error or a deviation from the prescription's intent and immediately escalating the issue to the supervising pharmacist. This aligns with the fundamental principle that pharmacy technicians work under the direct supervision of a licensed pharmacist, who is ultimately responsible for the accuracy and appropriateness of dispensed medications. The technician's role is to assist the pharmacist, and this includes identifying potential problems and bringing them to the pharmacist's attention. This proactive communication ensures patient safety and adherence to regulatory requirements for pharmacist oversight. Incorrect approaches analysis. One incorrect approach involves the technician attempting to resolve the discrepancy independently by making a judgment call on the dosage adjustment. This is a direct violation of the pharmacy technician's scope of practice, which generally prohibits independent clinical judgment regarding medication therapy. It bypasses the pharmacist's legal and ethical obligation to verify and approve any changes to a prescription. This action could lead to a medication error, patient harm, and disciplinary action for both the technician and the supervising pharmacist. Another incorrect approach is for the technician to ignore the discrepancy and proceed with dispensing the medication as written. This represents a failure to identify and report a potential safety issue, which is a critical responsibility for all pharmacy personnel. It demonstrates a lack of diligence and a disregard for patient well-being. This inaction could result in a significant medication error, with severe consequences for the patient and potential legal ramifications for the pharmacy. A third incorrect approach is for the technician to ask another, less experienced technician for their opinion on how to proceed. While collaboration can be beneficial, delegating a decision that requires pharmacist judgment to another technician is inappropriate and unsafe. It further compounds the initial failure to involve the supervising pharmacist and can lead to the propagation of incorrect information or practices. Professional reasoning. When faced with a situation where a prescription appears questionable or potentially erroneous, a pharmacy technician should follow a clear decision-making process. First, they must assess if the situation falls within their defined scope of practice. If it involves clinical judgment, interpretation of a prescription beyond basic data entry, or any potential deviation from standard practice or the prescriber's intent, it must be escalated. The immediate and primary point of escalation is the supervising pharmacist. The technician should clearly and concisely communicate the observed discrepancy and the reason for their concern. This ensures that the pharmacist can exercise their professional judgment, contact the prescriber if necessary, and make the final determination regarding the prescription's accuracy and appropriateness, thereby safeguarding patient safety and upholding regulatory standards. Question 20. Comparative studies suggest that state-specific scheduling variations for controlled substances are a significant area of potential noncompliance for pharmacies operating across state lines. A pharmacist receives a valid prescription for a controlled substance that is commonly scheduled as a Schedule Roman III drug in many states. However, the pharmacist is aware that some states have reclassified this particular substance to a Schedule Roman II due to emerging abuse patterns. The pharmacist's primary responsibility is to ensure the prescription is dispensed legally and safely. Which of the following actions best reflects the appropriate professional and legal standard for dispensing this prescription? Option A. Dispense the medication based on the prescriber's classification of the drug on the prescription, as their medical judgment dictates the appropriate therapeutic use. Option B. Immediately consult the official, most current controlled substance schedules and relevant statutes published by the Board of Pharmacy for the specific state in which the pharmacy is located to determine the correct scheduling. Option C. Contact the prescribing physician to confirm their intent and request a new prescription if the drug is scheduled differently in the dispensing state, without independently verifying the state's current scheduling. Option D. Dispense the medication as a Schedule Roman III controlled substance, assuming the most common scheduling applies, unless explicitly informed otherwise by the prescriber or a readily available national database. Correct answer is D. Dispense the medication as a Schedule Roman III controlled substance, assuming the most common scheduling applies, unless explicitly informed otherwise by the prescriber or a readily available national database. Explanation. This scenario presents a professional challenge due to the inherent complexity of state-specific controlled substance scheduling, which can lead to significant legal and patient safety risks if not managed meticulously. Pharmacists must navigate varying regulations to ensure compliance and appropriate patient care. The correct approach represents best professional practice because it prioritizes direct verification of the specific state's current regulations. This aligns with the fundamental ethical and legal obligation of pharmacists to dispense medications according to the laws of the jurisdiction where the pharmacy operates and the prescription is being filled. Relying on general knowledge or assumptions about scheduling, even if based on common patterns, is insufficient and potentially dangerous. The Multistate Pharmacy Jurisprudence Examination, MPJE, specifically tests this understanding of jurisdictional differences. An incorrect approach involves assuming a controlled substance scheduled in one state will have the same schedule in another. This is a critical regulatory failure, as each state board of pharmacy has the authority to classify controlled substances differently based on its own assessment of abuse potential and therapeutic use. This assumption can lead to dispensing a drug illegally, resulting in severe penalties, including license suspension or revocation, and jeopardizing patient safety by potentially dispensing a drug that requires different safeguards or is not permitted. Another incorrect approach is to rely solely on the prescribing physician's stated intent, without verifying the legal status of the drug in the dispensing state. While a physician's intent is important, it does not supersede the dispensing pharmacist's responsibility to adhere to the laws of their jurisdiction. This failure can lead to dispensing a drug that is scheduled more restrictively in the dispensing state, or even a drug that is entirely prohibited. Finally, an incorrect approach is to consult a national database without cross-referencing it with the specific state's official regulations. While national databases can be helpful starting points, they may not always be up to date with the most recent state-specific amendments or emergency scheduling actions. The ultimate authority rests with the individual state's laws and regulations. The professional reasoning process for similar situations should involve a systematic approach. 1. Identify the controlled substance and its prescriber. 2. Determine the dispensing state's jurisdiction. 3. Consult the official, most current controlled substance schedules and relevant statutes for that specific state. 4. If any ambiguity exists, contact the State Board of Pharmacy for clarification. 5. Dispense only after confirming compliance with all applicable state laws.